Hi, my name is Robert Treece. I'm a professional trainer and muscle activation technique specialist here at the Cooper Fitness Center. And today we're going to talk about specifically what muscle activation techniques is and what we can help address from a pain standpoint when it comes to our clients. Now, if you look at the body comprehensively like we do through with a muscle activation techniques approach, what we're actually looking at as an indicator of where pain may be is a range of motion disparity from one side to the other. So we're looking at the body comprehensively, we're looking at range of motion, and we're looking at, is there a difference from one side to the other? Do you feel tighter on one side than you do on the other side? And if you do, then it's a pretty good indication that the muscles on the side where you're feeling restricted probably aren't functioning at the level they should be. So we're trying to decrease compensation as an indicator of where your body's tightening up. So where your muscles are tightening up, that's an indicator of a protective mechanism of the body, where your body is actually protecting muscles that aren't firing as well as they should be. So some common issues we see with our clients here is lower back pain. So what we're going to do is take you through some range of motion that can give us some insight on whether or not you're having a problem in the specific area of your body that could be contributing to the back pain. The first place I typically start when I'm looking at someone's, if someone comes to me complaining of back pain, I'm looking at, let's kind of get everything out of the way that's closest to that area without actually being in that area. So I'm going to look at hip range of motion first. So I would take a client just to really see how much rotation they have at the hip going in and out, and then comparing that from this side to this side. The next range of motion I may look at if someone's complaining of lower back pain is just how much range of motion they have going straight up, just straight up into hip flexion. And so we'll just come up and we'd hold and try not to push down to the table with the other side so much. You're just trying to lift up one leg at a time and compare that range of motion from one side to the other. And yeah, I can feel that in-range position on this right side feels a little bit more limited than on my left side. Third range of motion I could do, just to kind of look at rotation, is kind of resting my foot on top of my leg and then rotating to one side. And I'm looking at pelvic rotation underneath my rib cage one way, and then pelvic rotation, going the other way. And that one's probably the easiest one to see. So that position right there definitely is the most limited comparatively out of the three planes of motion that we looked at. And so MAT is very plane specific. We want to look at, okay, where can we have the most effect with the least amount of treatment, or the least amount of process? How can we be as efficient as possible? So when we're looking at which plane of motion you're most limited in, that's the one we probably want to go after first. I get asked all the time, like, who is MAT for? Like, who can benefit from MAT, what we do with muscle activation techniques? And so I've heard it time and time again, from pediatric to geriatric, from professional athlete to everyday Joe. I mean, MAT can benefit almost anybody when it's concerning to getting their muscles to fire better and get more strength and stability within your range of motion that might feel restricted. As long as you're cleared by your doctor to do MAT, we're happy to do an assessment, and we're happy to address any of the imbalances that you may have and get you on your way to feeling better and performing the best that you can.